What is the Affordable Care Act's individual mandate? Have you ever wondered how health insurance affects everyone in the United States? The Affordable Care Act's individual mandate plays a key role in this discussion. So, what exactly is it? The individual mandate was a rule that required most Americans to have health insurance or face a penalty. This policy aimed to ensure that as many people as possible had health coverage. Why is this important? It helps spread risk and keeps insurance markets stable. Under the mandate, if individuals did not have qualifying health insurance, they could face a financial penalty when filing their taxes. Qualifying coverage could include employer-sponsored plans, government programs like Medicaid or Medicare, or plans purchased through the Affordable Care Act marketplace. This requirement was introduced to tackle the issue of adverse selection. Adverse selection occurs when only those who expect to need health care buy insurance, which can drive up costs for everyone else. By requiring healthy individuals to participate, the law aimed to create larger and more balanced insurance pools. This approach made coverage more affordable for those with pre-existing conditions and lower incomes. From a liberal viewpoint, the individual mandate is seen as a necessary tool for making health care more accessible. Liberals generally support measures that expand access to health care and protect vulnerable populations. The individual mandate was designed to work alongside other provisions of the Affordable Care Act. These include subsidies for low and middle-income individuals and protections for people with pre-existing conditions. Together, these measures aimed to ensure that more Americans could afford and maintain health insurance. The penalty for not having coverage was calculated based on either a percentage of household income or a flat dollar amount, whichever was higher. Over time, the average penalty increased but was capped at the cost of the national average bronze plan premium. Certain groups were exempt from the penalty, including those with very low incomes and people who would face excessive costs for the cheapest available plan. In 2019, the federal penalty for not having health insurance was eliminated, but the legal requirement to hold coverage technically remained. Some states have since implemented their own mandates and penalties to maintain the stability of their insurance markets. In practice, the individual mandate was a core part of the Affordable Care Act's strategy to expand health coverage. Liberals often highlight how this approach supports the broader goal of universal health care. By requiring coverage, the mandate helped make it possible for insurance companies to offer plans to people with pre-existing conditions without charging them higher rates. This reflects a belief that everyone should contribute to the health care system, ensuring that it remains robust and able to serve those in need. The individual mandate aimed to balance individual responsibility with collective benefit. This approach sought to create a fairer and more inclusive health care system for all.